Really about the same. I can't say that there's any significant change one way or the other. We're still getting applicants, they're qualified applicants, and we're still doing the screening. So I wouldn't say that that's going to delay the process.
One of our main concerns is, what are the risks of COVID-19 during pregnancy? And unfortunately, we have very little data. The data we have is from China, and the published reports are women who were infected in the second and third trimester of pregnancy. We don't yet have reports of women who were infected in the first trimester. And so infection in the first trimester would increase the risk potentially for miscarriage or congenital anomalies. So we don't have that data yet. The data that we do have is reassuring because we're not seeing the degree of pregnancy complications that we're seeing with the other COVID viruses, the SARS and MERS. So that's reassuring. Specifically with autism, I think we're far too early in this to have any added information on that. I think, and again, I think that our surrogate population is a very low risk population to get infected. And we educate everyone, all of our patients, all of our surrogates, and our egg donors on ways to minimize the risk of infection. So hopefully we can minimize it altogether. There's definitely not any increase in costs. If anything, I've heard from donor agencies, because people are been out of work, that they're anxious to get everyone, get their donors in treatment sooner, and I have seen some discounts offered by different agencies. So if anything, maybe the prices have decreased a little bit, but the changes in how we practice have not translated into any increased cost for our patients at all.
We're the same. There hasn't been any effect, decrease, or increase in terms of the structure of expenses that we list in our documentation on our website. We have built in some things to help parents, like, for example, delays in payments. In gestational surrogacy contract, it says that the surrogate gets an allowance, a monthly allowance of $250, and we're changing around the times of payments so that maybe they're not started until she actually starts medication toward an embryo transfer. So if there's any delay in getting to that point, the parents wouldn't be paying those startup expenses. And then again, like I said earlier, we've built in a possible refund of the initial retainer payment if there's some reason that the journey gets stopped related to COVID-19. So I can speak to the surrogacy side. I'm sure Dr. Ringler can talk to what happens on the clinic side. So in our experience, we think parents need to be prepared for about $100,000 to $120,000. And we have a document that spells out all the expenses. There's no secrets, but there are four main components that go into that overall total. One is the agency fee. In our agency, it's $28,000. You pay the first half of that upfront, and then nothing more until you're matched with a surrogate. The second and biggest part of that overall total is the surrogate compensation. And there you're exposed to paying approximately $60,000 or $65,000. It's broken down into different components in the contract. You might not pay all of that because some of those expenses in the contract with the surrogate are contingent. The third would be legal fees. These are all $10,000 or under, assuming the journey goes relatively smooth. And the fourth would be medical insurance for the surrogate, and that's where the swing is. That can be as much as about $15,000.
Well, I usually tell my patients, I break it down into three centers. There's the clinic costs, the surrogacy costs, and the egg donor costs. And when you add that all up together, it could range anywhere from $150,000 to $200,000. And there's different variables that influence that total amount, such as insurance, as Vicki mentioned, compensation to the surrogate, compensation to the egg donor. The medical costs are pretty standard. We have put together a package that includes screening of the egg donor, screening of the surrogate, treatment of the egg donor, genetic screening, and one or more embryo transfers. And I know everyone in the industry is trying to keep the costs low to make it more affordable for more intended parents. But unfortunately, on the medical cost side, the cost of everything keeps going up and up. So I think over the last 5 years, this 150 to 200 has crept up. I used to say 125 to 150, but it has crept up a little bit. So hopefully it will stay under that 200 upper border for a while. You know, we find that most of our patients actually do not have insurance coverage for the process. So, you know, there's some new tech companies may offer a plan that includes this, but unfortunately, most of our patients' health insurance does not cover it. Some insurance will cover diagnostic testing, but won't cover treatment. So it really depends on the specific plan on what they cover and don't cover.
That's one area that's really problematic for people. It's really hard for intended parents to use their medical insurance, especially, unfortunately, gay intended parents in the medical clinic, because you have to, it's a discriminatory provision, but you have to show infertility in order to be able to use some of the insurance that you might have. And so that's a problem. That's been a problem. People are advocating, trying to change it. So unfortunately, there isn't really much you can use your insurance for except for your baby. When your baby's born, you do need your insurance for that. The surrogate will have medical insurance. So one way or the other, she's going to have insurance, and that will cover her medical care and treatment for prenatal care, not at the IVF clinic, but with her obstetrician and then with the hospital. So that there will be insurance for that, but it won't be your insurance.
Last week we started new treatment cycles to create embryos and to freeze them, but we have not yet started doing new embryo transfers. Our plan is to start next month in June, and the delay is there's still this concern, of what are the risks of COVID-19 during pregnancy, because there is not a lot of data. The reports out of China include very small numbers of patients. Although it's very reassuring, they only include a small number of patients. So we want to proceed as slowly as possible to make sure if there's no new study showing something that's more harmful. What we do know so far, the reports that have come out do look more reassuring than what was seen with the other coronaviruses, but there's not a lot of data. For the past month and a half, we've been basically stopped in terms of doing new treatment cycles, but during the past month and a half, I've been doing new patient consultations, new surrogate screenings, new egg donor screenings. We're still doing testing, so guys can come in to have their sperm analyzed, they can freeze sperm. So it's really a great time to get ready, to get prepared for the process. Last week, after the ASFRM guidelines were lifted somewhat, we did begin new treatment cycles. So we're gradually restarting treatments, and we're starting gradually just to minimize the number of patients in the office at the same time. And I think in our profession, like most professions, it's a new normal. It's a new way to practice, just to minimize risk to the patients. But today, an intended father who wants to start the process, he can absolutely start.
Yeah, I think we're really getting back to what has been our very typical model of going through a surrogacy journey, which is you can sign up with an agency now and be waiting for your surrogate. It's 4 to 6 months, it won't be longer. And you also, same time, which is the typical model, at the same time that you're waiting for your surrogate, you can go to your IVF clinic and do your semen analysis and select an egg donor and make your embryos. All this can be done over the next 6 months or sooner. And then we have the embryos, and then we have a surrogate, and then we head into the second phase, which is getting the surrogate ready for an embryo transfer. So we're right back to where we've been normally doing things for people. Everyone needs to make decisions that work for themselves. So one issue that comes up is, will the surrogate travel? So oftentimes in our typical model, the surrogate lives in a state that's not near the medical clinic and she has to fly there. So we have to find out whether a surrogate's willing to travel. If she's not willing to travel, who do we match her with so she can drive to her embryo transfer? And parents need to have a level of comfort along those lines too, in terms of travel. We do have surrogates who are willing to travel, and they are going to be provided with masks and gloves and PPE so that they could travel safely. People are traveling. Again, we're going to have to take precautions and do things in a different way than what we're used to, but this can be done. And we are really just encouraging everyone and making sure that they have the right masks and gloves to be able to go places they need to go and be safe.
You know, when I meet with the new surrogate as part of her initial screening, she's not allowed in our office without wearing a mask, but you know, they all come in regardless. They all come in with their masks on. And I asked them how they've been protecting their children, you know, and their family members during this crisis. And I've been very impressed with the degree of commitment they have to protecting their loved ones. So their kids are out of school, their kids are staying home, they don't let their kids go out. Most of these mothers, they haven't gone out much. If they're working from home, you know, because they have a family to protect. And, you know, everyone wants to stay safe and healthy. So, but I do review with them safety measures on how you can minimize your risk through frequent hand washing, wearing your mask. You know, I explain what changes we have made in our office when patients come in to minimize their risk, including, you know, no one waiting in the waiting room, questioning at the time of appointment, at the time of entering the office, and minimizing the number of people they have to have contact with. So it's a commitment that, you know, we all have to do.
We don't exactly have a payment plan, but there are medical lenders. Like on our website, we have a lender called Prosper Lending that gives out unsecured loans at good interest rates as long as your credit's good. And as Dr. Ringler mentioned, Men Having Babies has a grant program for those who meet the eligibility requirements. And I think you can break it up. I think that's a very good point, that you can make your embryos and have them and know that you have them, and then spend some time gathering up your funds or planning for the loans that you'll take to then be able to pay your surrogate and create and have your embryo transfer and move along that way. Things are staggered. I mean, it is a 1.5-year process. You do have to put a lot of money up front before the pregnancy into an escrow account. But I think if you started now, you would have some staggering of the payments over the first 6 to 8 months.
Absolutely. I've seen more single gay men, single straight men deciding that, you know, they're ready to start their families. And, you know, it takes hard to find the right partner. So, you know, we're all getting older, and men have biological clocks too. So I'm seeing more and more men deciding to do it on their own. And I think, you know, there has to be a huge commitment to build a family. And so, I mean, sure, if you have a partner, he or she will help you in the process. But, you know, each individual has to have that commitment, has to have the desire in their personal heart to proceed in the process. So I think ask a lot of questions, be firm in your commitment, and find the right group of professionals to help guide you through the process. You know, all of us are very caring individuals. We love what we do. There's great resources within each clinic, within each agency to help individuals through the process.
For any intended parents going through surrogacy, counseling can't hurt to uncover the stones that, you know, you might run into, whether you're in a couple, whether you're single, whether you're gay or straight. It's a complicated process, and it can be a stressful process. So getting yourself some support from a competent professional would be a great idea. Other than that, yes, we've had many single intended parents, men, women, trans men, and they've happily and delightfully had their children through surrogacy. I think it's important to have support in your life. It doesn't have to be a partner or significant other, but it can be maybe a trusted family member, a sibling, or a good friend. But I think, and it doesn't have to be a lot of people. It just there should be a little bit of a support system for any parent, single or in a couple. But I think as a single parent, it'd be nice to have someone to share the ups and downs with, even if it's not an intimate partner.